a lot more convincing for them rather than you standing up on a high pedestal and deciding on the treatment plan unilaterally. The moment you're able to explain things to them properly, then they take it in the right sense, and you can be more certain that the patient is going to be with you forever. You have to suggest all the treatment options. Even if the patient has come to you specifically for implants, you've got to tell him what are the options you have. Option 1, removable dentures. Explain the pros and cons. Option 2, crown and bridge work. Explain the pros and cons. Option 3, dental implants, pros and cons. And what is the option 4? Do nothing, pros and cons. You see, you've got to explain all this. It is mandatory. There was a case in the US. What happened? The man walked into a practice and he wanted a missing tooth replaced. And the doctor over there decided that a bridge work is going to be the best. He knew about implants, but he was not aware, he was not trained in implants. So he decided to do a crown and bridge for him. And he decided that he's going to do crown and bridge. He went ahead, did it. After 4 years, the chap shifted from that particular state to a different state in the US. He went for his routine dental examination. When the dentist there casually asked him, all your teeth are healthy, and why did you go for bridge work? Why didn't you go for an implant? That struck him. He was shocked. He said, what? What do you mean by dental implant? See, a dental implant is a screw which is inserted into bone, and you take support from the implant. You don't injure the adjacent teeth. When this was told to him, he was shocked. He said, why didn't the first dentist tell me this? He should have told me. Immediately he sued the first dentist. You see? Why? Because he was not given that option. So, you should be able to give all the options. It is very, very important. India is also progressing on those lines. So, we've got to be careful about, about finalizing the treatment plans unilaterally without discussing with the patient. You just have to jot down points, that's all. You just have to have templates and jot down such and such options were given, that's all.
4 years down the line, what transpired between me and the patient?
No, all that will be there in your case record. It will definitely be there. You just need to tick off. You just have to have a checklist, and you just need to tick off and file that, either as a soft copy or as a hard copy. You have documented it, that's it. See, please remember, this may sound a bit painful initially. It may sound a bit painful, but then once you have that system in place, this happens automatically. You can delegate all these duties to your juniors. It's not necessary that you do it yourself. You understand? You have a system in place and everything will happen automatically. Medications used, very, very important. You've got to mention about the drugs used, the dosage, and the duration of the drugs, which is very important. And aftercare, what are the aftercare measures you've advised? You have the water pick, use of the water pick, you have the interdental brushes, and also emphasize on the importance of occlusal corrections, which may be necessary once a year, which is extremely important. He should not just vanish into thin air thinking that all his work has been done. You see what happens over a period of time when the patient keeps chewing, automatically there will be some slight changes in the occlusal, and definitely he is going to run into issues. So it's most certain that he reports back to you for review and checkup and for occlusal adjustments. Follow-up visits, you've got to specifically indicate when the patient is supposed to come back for the next follow-up visit. The advantage is, if you have documented all this, if he does not report to you, you can say, okay, you are having such and such a problem only because you did not come back to me on such and such a date. You see, all that is important. Prognosis, you should be able to explain the possible side effects and complications, and also have an informed consent. You should have an informed consent form in which you get it written by and signed by the patient saying that I have understood the treatment plan by the doctor and I agree to undergo the procedures as suggested by the doctor. And you also have a discontinuation form. I even use that in my practice. There are some patients who just decide to discontinue all of a sudden because of some strange reason. It's very rare. But then I immediately ask them to sign this discontinuation form. It's important that you're aware of the consequences and you please sign this. I don't give